Ambulance. Sir. Sir. Checking the patient. Confirm no pulses, patient's not breathing. In arrest, beginning high performance CPR.
Cool, looks like we've got space for an arrest here. Pause.
Pausing.
Analysing.
Analysing now. Stand clear.
Clear.
Start
Starting
CPR.
CPR. Nice clear area.
Comms crushes 10, R49, R50 please. IV gear. Airway dump set up
4,
here.
3, 2, 1.
Pause.
Shock. Advised.
Shocking. Start CPR.
Turn the light back. Please.
Start at
Start
metronome.
CPR.
Preparing airway. In title attached.
Confirm in title attached.
Oxygen connected at 10.
Copy.
We have tube holder with airway light for timing being placed. And we have our LMA, we're estimating size 3 at the moment.
Copy.
Syringes attached and ready to go. Always good.
Metronome's on, we got backup.
Backup's coming.
Yep.
Excellent.
Excellent. $30.
LMA is ready to go. Suction's ready if we need it. Oxygen bottle is full and set at 10. Bags ready. So we're swapping on this round.
Copy.
So I'll say swap and press analyze.
$5 seconds. 1.
Pause. And
Pausing.
swap.
Analysing now.
Analysing.
Moving to the
Stand
head.
clear. Start CPR.
Start CPR. 10 seconds. 3, 2, 1. Pausing.
Shock.
Shock advised. Delivering shock.
Starting
CPR.
Hey guys, I'm Justin, this is Ruby.
Start
Hi,
CPR.
John.
Hey guys, what's happening today?
So this is John. He's 68. He appears to
Preparing to gain an
a
airway.
VF arrest. We've delivered 2 shocks in AED mode. And he
Checking
still
for my
appears to be VF.
LMA.
Wonderful. Okay,
Confirm
looks like
size
you're
3
doing very well with
LMA.
CPR. What I'm going to do is turn the machine into manual mode now.
Checking
Okay.
patient airway.
So it looks like the time is 11:52.
Airway appears clear.
So the next shock will
Placing
be
LMA.
at 11:53. So we put into 360 joules. Okay, so 11:53:30 is the next shock. Right, so what I'm going to do is I'm going to set up for an IV. It looks like Eric's got the airway underway.
In place.
Okay,
Placing
and,
holder.
Chris, you just keep doing the good job you're doing there. And
Timing light
I'll
is
give you some
active.
warnings just before we come up to the next phase.
Great.
Okay?
Thank you.
Just going to put the
The metronome set at 110.
oh, perfect. Okay. So we're about a minute from the next shock. Okay, so I'm just setting up some IV gear. So I'm going to put an 18 gauge.
Confirming
ready to
high
go.
flow O2 on 10 liters. Beginning bag mask with the 3 rule, 3 fingers, 1/3 of the bag.
Wonderful. And you've got a timing light I can see there, Eric. It's working well.
Timing light is active.
Okay, fantastic. So we're coming up to 30 seconds now. Okay, so at 15 seconds I'm going to hit charge. Okay, and then I'll give you a tap on the shoulder, Chris, and say swap. And then we're going to swap with Ruby, taking over the compressions. Okay, so I'm charging up now.
Charging.
Okay. Okay, VF, shocking. Back on the chest, please. Wonderful.
Can I set up the fluids for you?
Yes, I'd love you to set up some fluids for me, Chris. I've got some just here actually. So I just got the Doug check it. This sodium chloride, December 21.
This is
Okay.
sodium chloride, it's
I'm just going to place
December 21. Open.
IV in now, okay? So I've got the tourniquet on. Okay, I've got an 18 gauge.
Airway appears patent.
And I'm just going to clean the site. So I clean the site. Okay. Wonderful. Sharps are out. Okay. 18 gauge into the left ACF.
Confirm
Okay.
18.
I'm going to take the tourniquet off now. Okay, and I've withdrawn the needle. Tourniquet is off. Okay, tamponading. Sharps away. Lure plug on. So it's going to secure the IV. So I secure the IV. Okay, wonderful. I'll get rid of
Give me
this.
some attached fluids run through. Ready to
Perfect. So
go.
primed and ready to go. We've jug checked it. Ideal. Okay. So now, what we'll do is we'll continue doing what we're doing, just like before, Ruby. I'll give you a tap on the shoulder. I'll give you a 30-second warning, a 15-second warning. How's your LMA going there, Eric? It looks like you've got a good
Yeah,
end tidal,
yeah.
so it's
LMA,
working pretty well.
LMA feels good.
Okay, perfect. No blood or any mucus or anything in the
No.
line? No. Wonderful.
We'll just check when we get a chance for chest rise and fall.
So we've got a ICP backup coming in about sort of 10 minutes, okay, so we'll just keep going as we are. Okay, on the next round I'm just going to draw up some adrenaline, alright? Okay, so we are 30 seconds out, okay, from the rhythm check. Alright, I'll charge on 15, just like I said before, Ruby, I'll give you a tap on the shoulder when we're ready to go.
Good rate, Ruby, good depth, good compressions.
Yeah.
Good release between compressions as well.
Okay, so charging. Okay, swap please. Still in VF, shocking.
Confirm good
I
chest
think we
rise
see
and
it.
fall.
Okay, so what I'm going to do now is I'm going to draw up some adrenaline, okay, because we're in a persistent VF. Get some adrenaline out. What I'll get for you to do, if you could, Ruby, please, if you could just drug check that adrenaline for me.
Yep, aspirin adrenaline, O2, +1.
Perfect. Just going to break the adrenaline, okay. I'm going to draw it up using a drawing up needle, okay. So I've drawn up the adrenaline, okay. Sharps are in the sharp spin. I've also double checked that the adrenaline is 2021 and it's adrenaline. Okay, so I'm going to label it. I'm going to label it with adrenaline. It's 1 milligram per mil, and the date and the time that I've added it. Okay, so that's just staying just there. Right, we'll use that on the next thing. Compressions are looking good. Airway still going good, Eric?
Yes, we had good chest rise and fall just before that last shock.
Wonderful. So let's just recap. We've obviously got an unwitnessed cardiac arrest. We've had multiple shocks now. We don't really know anything about his medical history. It doesn't appear to have any scars on his chest or anything like that.
No brushes or anything.
No rashes, no family members around. Okay. So what we'll do is we'll continue working the VF arrest as if it's a primary cardiac arrest. Okay. And on 30 seconds, I'm just going to let you know. So we're coming up to 30 seconds now. Okay, and just like before, on 15 seconds we're going to charge. I'll give you a tap on the shoulder, Chris, and I'll say swap, and we're going to swap with Ruby. Alright? But apart from that, you're doing really well. Eric, the airway's going fine?
Yep, airway's still good.
Perfect. Okay,
We'll
so
reconfirm on
charging.
the next shock. Charging.
Wonderful, if you could swap.
Swapping.
Okay, we're still in VF, shocking.
Confirm good chest rise and fall.
Okay, so in this round what I'm going to do is I'm just going to put the adrenaline in that we're given. So what I'm going to do is I'm just going to stop the line for a second. Okay, I'm just going to push the adrenaline through, and I'm just going to run it through with a little bit of saline. Okay.
I want to event that.
Yeah, and I'll event that on the screen. And so the adrenaline's gone in at 45 minutes past, so we're due the next adrenaline at 11:49.
Copy.
So I'll just
Confirm.
put that onto my hand, so we're aware when the next adrenaline is. Okay. We'll just recap. Ruby's doing some good compressions. The airway's still looking good. Managed by an LMA. There's sort of no concerns at the moment. End tidal was looking good. what we'll do is we'll start looking at some amiodarone for the next round. If it continues to be in VF or VT, ICP should be here any minute, so we'll be able to give a handover and talk about some other options available when he arrives. Still no other information or history.
No signs of anything.
No signs of anything unusual, which is good. It was obviously called in by a bystander, but they've subsequently left. Okay, so what I'm going to do is I'll give you a 30-second warning again, and on 15 seconds we'll charge and we'll go swap. Okay? I'll tap on the shoulder when I say it. Okay. So 30 seconds. Seconds, so just charging. Okay, swap please. Still in VF. Shocking.
Starting CPR.
Reconfirm, good chest rise and fall.